A deadly strain of bird flu has been detected in dairy cows for the first time. Scientists are calling it D1.1. At least 4 cattle herds in Nevada have tested positive. Health officials say this form of the virus has recently become the predominant strain of bird flu in wild birds and poultry across North America. It's the same strain that killed a Louisiana woman last year. This is now the second time a strain of the virus has transferred from birds to cattle. The CDC says the health risk to the public remains low, and there's no evidence of human-to-human spread. Dr. Jacob Glanville joins us now. He's the CEO of Centivax, a San Francisco-based biotech firm. Thank you so much for being here, Doctor. This strain was never before seen in cows. Nowadays, what does that say to you about the virus?
Yeah, so this is concerning at a couple levels. The reason that H5N1 has always been at the top of the pandemic risk list is that over the last 20 years, we've seen about 1,000 cases of H5N1 that goes from birds or other animals into people. And when that happens, about half of them die, which those are Ebola numbers. So they're very concerning. Now, this outbreak, we've had about 70 people infected. And for most of them so far, it's been mild, but we don't know how many mutations it's going to take to make it more virulent and to enable human-to-human transmission. So getting back to your question, the issue with cows is that we now have 2 different types of strains evolving in the cows, which means that their genetic information could shuffle and could accelerate the creation of new mutations that could make it easier for the virus to transmit human to human and could make it easier for it to mutate back to its old ways of being highly lethal.
I want to circle back to this a little bit in a moment, but between cow outbreaks and outbreaks among chickens, do you feel like this news will further impact the food supply? What does it mean for our food supply?
Yeah, sure. So we have everyone's experienced the problem with just getting access to eggs, and California has declared a state of emergency based on massive infection in our cattle. It will likely continue to affect our food supply because our current method is culling. It would be nice to be able to vaccinate those herds, but the alternative is you have to kill all the animals. The other risk here is that when you have lots of chickens around people and then lots of cows or mammals around people, it just makes it easier than ever for the virus to jump towards humans. So there's a food access problem, but there's also a public safety problem.
So you mentioned that we still don't know how many mutations this will need to undergo before it becomes more virulent and could pass more easily to humans. I mean, experts keep saying that the risk to public health remains low. Do you share that sentiment? At what point would you change your mind?
Well, I think that sentiment's evolving. I think until we see it transmit human to human, then we get very worried. But it's not 0 to 60. Right now, we know that this is now circulating in cows, and it's not just going away, and there's new strains coming in. And that's dangerous because you have a mammal that lots of people are hanging out around, which now can transfer over new mutant strains to humans. So I think we're in a moderate risk scenario. I still think until we see it get more virulent and until you see human-to-human transmission, it's something to monitor but not to panic about. But I also think it's critical at this point that we invest resources in preparative vaccines and countermeasures in the event that we do see human-to-human transmission take place. This is the work that my company does on broad-spectrum vaccines. The U.S. government recently spent $590 million on a strain-specific vaccine to be developed. And I think it's time to do that now because the virus is so close to the human population and we're seeing spillover take place.
Interesting point. All right, Dr. Jacob Glanville, thank you.
Thank you.